station.
This is Afternoons on DubaiEye 103.8.
We're talking skincare, even chemicals and makeups that a lot of preteens are using on their face, which they don't actually need. Dr. Aishani Shah, dermatologist from the Mubadala Health Clinic, is here. She's a specialist dermatologist here to answer any questions that you have on skincare. So do text us on 4001. So, Dr. Aishani, one of the big things here is the sun. And, you know, a lot of children, even my nephew and niece growing up, they were like plastered with sunscreen growing up. How safe are the sun protection lotions here? And also when it comes to tanning with young children?
That's such an important topic that we have to discuss, because I feel sunscreen is something so vital in your skincare. You may have an elaborate skincare routine, but if you don't have sun protection, there's no use of having any elaborate skincare, you know. So sunscreens, first of all, the most important thing that you need to look in your sunscreen is your SPF, which is your sun protection factor. And anywhere above the SPF of 30 or higher is the ideal sunscreen. You should also be looking for a broad spectrum sunscreen. And that means when you see your sunscreen bottles, the plus marks that you see on your bottles are your PA+, PA++. So that tells you how well it is going to protect you from the UVA and the B radiations. Of course, go for mineral sunscreens and not chemical sunscreens.
I was going to say, so what are we supposed... Because I know parabens are quite dangerous in a lot of this. So what are the ingredients that maybe we need to avoid or particularly look for to say that they're organic? Because they're not always organic.
And also, the labels that say organic, also when you turn the bottles, most of the time they do have chemical ingredients in them. So the ingredients that you should look out for, absolutely good ones, are zinc oxide or titanium oxide, which are your mineral sunscreens. And then the things that you should avoid are your chemical sunscreens, such as oxybenzone or, other parabens inside them. And these days, there is a lot of addition of silicons and mineral oils and essential oils. So absolutely, it should be like a fragrance-free product. And a broad spectrum is what I would definitely look into.
Okay. Now, I used to wear makeup, heavy makeup, 5 days a week for 8 years because I had a TV show. I had no choice, right? And it was done by a makeup artist. Yeah. And you always have to wear double the amount because you're on TV. And because of that, everyone was like, you definitely need to go and have facials. You're all clogged up and everything. In 8 years, I think I had 6 facials.
Right.
And the reason is because I grew up, like you, I'm Indian, with the very holistic way of taking care of my skin. I open my fridge. Yeah. There's turmeric, there's honey, there's fridge.
Home remedies.
To this day, I still use that, right? Yeah. And what was interesting is a dermatologist friend of mine said, you don't need this many facials that are scraping your skin because it can rejuvenate itself very naturally.
Absolutely.
And most of it is just a marketing ploy.
Yes. And I second that, because you don't need your skin to be squeaky clean, right? You need a little bit of oil. Those are your essential oils to protect the natural skin's barrier. So if you're stripping your skin by over exfoliating, over cleansing, you're also allowing your skin to be free of those natural oils. So what about your natural epidermal protective barrier? You are introducing and allowing your skin to be exposed to so many of the allergens and environmental hazards, and that's the reason we come across patients with a lot of viral infections, warts, molluscums, because their natural epidermal barrier is not intact anymore because of over exfoliation, double cleansing, the trend that is going on.
I know, it's ridiculous. I mean, even like my mom had said, just sometimes get some gentle milk or yogurt and just put it over your face as a cleanser. Yes. And I do, and my skin, I've never had any issues with it. Yeah. So we've had a text saying, what do you use to remove skin pigmentation? What would you recommend?
So, skin pigmentation, it's a very, very vast topic. It has to be, first of all, we need to know what kind of pigmentation you have. So if you're someone, say, above the age of 30, 35, and you've been dealing with pigmentation, which is primarily hormonal pigmentation, also known as melasma, and most commonly seen in women, especially after pregnancy, delivery, due to the hormonal fluctuations, then you need to sort of first and foremost make sure for any kind of pigmentation that you have your sunscreen in place. And sunscreen also not just applying it and going out. You have to apply it at least 15 to 20 minutes before stepping out. You need to reapply it every 3 hourly if you're out for more than a few hours. Once your sunscreen game is correct, then you work on your pigmentation, and according to skin type, we would sort of recommend different active ingredients or topical vitamin C, kojic acid, arbutin, and then in-clinic procedures as well.
So if let's just say I'm getting a cab for 2 minutes coming to work and I'm working under these lights, would I need to still put skin?
Absolutely.
Because of the lights?
Absolutely. Because of the blue lights, your computer screens, and that's where tinted sunscreens come into picture. So we have something known as tinted sunscreens, right? They match your color and the shade of your skin. So tinted sunscreens not only help you against the UVA-B, but they also help you against the blue lights. That's also very important because most of us are sitting in front of the computer screens and working as in office jobs.
But there are also like some people, you've got your overall sun protection for your whole body, and then there's brands that have it's just specifically for your face. Are they ultimately the same? Can you use the body one on your face?
You can use I would rather say the opposite, because you can use the face ones on your body, because we would generally want, when you're applying sunscreen on your body, you're not very, very particular about the non-comedogenic part. But when you're applying it on your face, because your face has multiple oil glands, you would definitely want to go with something which has no white cast. It's very light. It doesn't clog your pores, and it's not heavy. So usually the body ones come in spray forms, which are very convenient to apply. Also because you need to apply it on your back and you need to reapply it. So it's just the ease and the convenience that they come in sprays. But then they don't focus about the non-comedogenic part.
Yeah. Okay, Maya says my 9-year-old has started to get small blocked pores on her nose. Now, I had horrible acne as a teenager and bad skin all my adult life. I'm very sensitive about my skin, and I'm worried that my daughter will have the same problems. I've not said anything to her and don't want to make her self-conscious. Do you think I should encourage her to start using a mild face wash? And if so, any recommendations?
Well, absolutely. Now, the nose is one of the earliest areas where, teen skin starts getting acne because of the sebaceous glands on that area. I would definitely encourage using a gentle, mild cleanser. And what you get over the counters usually have very mild salicylic acid in it. So it's ideally generally safe. But I do still recommend doing a little bit of a test area just to see whether there is any, reaction to it. And if the acne is more, then definitely a consult, because then nose is also an area where you'll get a lot of open pores, which is a problematic area. Then, you need to sort of do procedures when you grow up. So I would start early with a gentle cleanser, say 2% salicylic acid, and then probably get a medical prescription if required with a medical grade salicylic or a benzoyl peroxide gel.
Okay, amazing. And just one word, what do you think of all these celebrities? These kids are looking up to these celebrities, but they're all making makeup brands and just using chemicals. I don't understand the logic in it. Is it just a lot cheaper to make it with chemicals than actually think about these young people buying their products?
I feel these days everybody is their own chemist and everybody wants to sort of formulate their own things. And there's a lot of marketing noise on social media, primarily to package and make everything colorful and to attract all kinds of audiences. And we need to understand that the influencers, these that are there, their audience, the products that they are sort of talking about are not necessarily meant to be used by the teens and the tweens and the Gen Z, right? So you really, really need to understand and look for the ingredients and the labels before getting yourself into any skincare routine or makeup.
Yeah, thank you so much. You can find Dr. Aishani Shah at the Mubadala Healthcare, she's a specialist dermatologist. Where are you located, by the way?
So we are in Jumeirah 3, which is right in the, heart of Dubai. And it's in Sunset Mall. We are at the first floor.
Yeah, I was there the other day.
Yes, so you can find us there. And we have multiple specialities and everybody is more than welcome to come visit us.
Okay, next time I'm passing by, I'll come and say hi.
Absolutely.
Thank you for coming on the show.
Thank you for having me. Pleasure.
They tried to make me go to rehab. I said no.